Morning, everybody, and welcome to What's Happening in Health. So glad you're joining us for this Sunday morning news hour. We've been telling you throughout the pandemic that the Zoom boom has led us to make many changes in our appearance when we don't like what's on the screen. So from hair transplants to hormones, we are going to share some of what is new to help us look good and feel better. Mark Lucas and Troy are joining us today. Give me a quick wave there, guys. They are going to tell us a little bit about hair transplants, and what we need to know. And we're going to share in Look Good, Feel Better as well with that theme this hour. Plastic surgery and what's driving up demand for it. This sweetheart, look at her. Here's a contrast for you. Dr. Jon Mendelsohn and Chris Ward are joining us in studio. Good morning to you. We are so glad you're here. We're going to talk a little bit more about your procedure. Quite a contrast there, my friend. All right, just ahead, the plastic surgery surge. What's behind it? And does it fix more than your face? There's the question. Dr. Jon Mendelsohn, Chris Ward here to talk about it with us. Good to have you guys in studio. We'll share it. Look good, feel better on what's happening in health. Welcome back, everybody, to Look Good, Feel Better, and our team from the Advanced Cosmetic Surgery and Laser Center. We have a full hour today on ways to help you look good and feel better. Dr. Jon Mendelsohn, Chris Ward joining us. We're so glad to have you here today.
Nice to be here.
And we are going to share a little bit more about why they are talking about kind of some amazing stuff. But the American Society of Plastic Surgeons now says this pandemic has led to a serious plastic surgery surge, as we call it. And it's a trend that does not seem to be going away. So before we talk to them, we just want to give you the backstory.
My job during COVID, we did Zoom calls constantly, and I do think that was a big thing.
And when those calls became a permanent meeting thing, as they have for many of us, Chris Ward decided it was time to go under the knife.
I would sit there and try to adjust the lighting in my office, and I would, try to put like there's a little bit of a blur filter. I was like, does that look better?
She asked facial plastic surgeon Dr. Jon Mendelsohn to perform what's called an advanced lift. His surgery team provided this video. It's performed through a tiny incision inside the top of the ear.
We're separating the skin from the underlying SMAS layer. It's a fascial or connective tissue layer. We're advancing that layer upward to support it. Fold, jawline, and neck are all tightened, and then we're removing or excising the redundant skin.
It took a while, but Chris documented her journey on YouTube as the swelling went down. Eventually, she went from this to this.
The neck and the jawline are probably my biggest improvements.
But Dr. Jon Mendelsohn told me the plastic surgery surge that started in 2020 has continued as more of our lives are now permanently on screen. And it's not just faces that we are changing. The American Society of Plastic Surgeons reports since 2020, the Zoom boom, as it's often called, has led to a boost in breast enhancement, liposuction, rhinoplasty or nose jobs, eyelid surgery, and facelifts. Many report what Chris says surprised her most.
From the inside out, I feel 100 times better.
All right, so we wanted to make sure from the inside out, she still feels 100 times better, do you?
Absolutely.
Really?
Yes,
What's the
absolutely.
biggest difference?
I think there's a big boost in your confidence, not being as apprehensive in going on those Zoom calls, and just overall every day, when you look in the mirror and you're not criticizing everything about your own face.
So you call that the advanced lift, but the whole idea behind that is it's supposed to look pretty natural?
Yeah, we definitely want a natural outcome. It's, I think that's the biggest fear that people have, is looking pulled or unnatural. So yeah, we strive for a natural outcome.
So does anyone say anything like, oh, what is their reaction?
I really haven't had anybody proactively say anything. Now, I have shared I've been very open and shared my journey clearly, publicly. So everybody, of course, is very complimentary, but I haven't had anyone that I haven't shared with actually say anything other than, gosh, you look great, and leave it at that.
Oh, well, that's a good thing. So we have a little of that video I wanted to share, because one of the things that I think both of you talked about is there's an emotional side, and I wanted Dr. Mendelsohn to start this, because you said when you first get it done, you're kind of surprised that you feel kind of, nervous, scared. I don't know what the word is.
Yeah, I think that setting the expectations properly is a big part of everything that we're doing. And Chris, I know, doesn't remember talking in that segment there. She was right post-surgery. But you know, you look like a pumpkin or an alien, or we use a lot of adjectives afterward.
Right.
We do try to prepare patients well. Because the surgery itself isn't so bad from a patient standpoint, or the first night, actually patients do very well. I think what happens is the expectation that 3 days later you're all healed is what people strive for. Everybody says that that's not how they feel, but every day seems like a week. And I think Chris experienced some of that. It took her about a month or 5 weeks before you really
Right.
felt comfortable.
What were you feeling when you weren't comfortable?
I was feeling anxious of, am I going to look normal at some point? Because you do, as Dr. Mendelsohn stated, you do look, what I described it as is an avatar or an alien, a lot of the fullness in the upper face, so it's really kind of triangular. So I was very concerned, is this going to heal properly, and am I going to look, you know, have a normal looking face again?
So do you feel that it looks normal now?
Oh, absolutely, yeah.
You know, normal's, as we say, setting on the dryer, so you know, everybody kind of has a different look. So one of the things I thought was very interesting, and you may not even know she said this, but she said on like day 4 or something, you sent her flowers. Like, you're expecting that they're going to have, is it buyer's remorse? Or
You know, it's really common with any surgery. We pay more attention to it with what we do, but usually about that day 3 or 4, about half of our patients experience just a little mental, a little depression, little lull in their recovery. And yeah, the flowers usually are helpful.
because is it what was I thinking, or?
Yeah, I think it's, you know, from the epinephrine, from the procedure, from the excitement, from the fatigue. We don't know exactly what causes it, but it really is a real phenomena.
So what do you think now that you're 3 months out, roughly,
Right.
and you feel more normal? What do you think you would tell people that you didn't know at the start of the journey?
I think I would tell them that you have to trust the process. Dr. Mendelsohn knows, I guess Dr. Mendelsohn knows the process way better than what we do. And I think, especially when I came in at day 7 to have my sutures removed, and everyone in the office said, "You look fantastic." For me, that gave me actually even higher anxiety, because I didn't feel like I looked fantastic. But I think what they were meaning to say was, at this point in the journey, you look fantastic. They know what the final outcome is going to be. So just to trust the process and know that they clearly know what you're supposed to look like as things are going along, and to trust the process.
Yeah, so we should let people know that this can be anywhere from $2,000 to $12,000 depending on all the areas you work on, and it's usually not covered by your medical insurance. So we want to make sure that we have a phone number up if we want to find you. But just final thought, we saw that this is really kind of growing. I know we want to look better, and COVID helped that, but I'm shocked now that people are so open about it. What do you think has changed? Is it just the whole stigma thing?
Yeah, you know, I think it started back with Botox years ago. You know, we used to hide our Botox, and then that became normal. It became normal for everybody from age 20 up. And I think this is a process. I think people are looking at themselves, and they do want to look and feel better, and they're sharing it with their friends and family more.
Because it used to be like, oh, but I don't want anyone to know, and don't tell anyone.
Well, looking natural, that's different. And if you
Yeah.
ask Chris initially, I don't think that she would have wanted to show things off. You know, people don't want to make a mistake if that was her final result at a week. But later on, I think patients usually want people to see, you know, your hair looks good, your skin looks better, whatever it is.
Right, right, right. Well, we look forward to sharing some of this hour with you and your team. It's just a good time to talk about this. We're sort of moving forward from COVID-19, and a lot of us are having these same questions. Thanks for being here today, guys.
Thank you, Liz.
Thank you.
Yeah.